हेलो व्यूअर्स, आज हम गुजरात पब्लिक सर्विस कमीशन में नर्सिंग रिलेटेड जो क्वेश्चन पूछे गए हैं वो 50 क्वेश्चन आज हम पढ़ेंगे। फर्स्ट वन इज एजुकेशनल ऑब्जेक्टिव शुड बी ऑल ऑफ द फॉलोइंग एक्सेप्ट अटेनेबल, रियलिस्टिक, अनइक्विवोकल और मोटिवेशनल। तो क्या ऑब्जेक्टिव नहीं होना चाहिए? आंसर इज unequivocal. Next question is crossover design involves the exposure of same subject to more than one experimental treatment. Crossover design involves the exposure of the same subject to more than one experimental treatment. This design is also known as Solomon 4 group, randomized block design, factorial design or repeated measure design. Answer is repeated measure design. Third question is standing on repeated use plans involve objective policies, procedures and method. Option A. Option B, programs and budget. C, budget and single use plan. D, rules and strategies. Answer is objective, policy and procedure and method. Next question. A nurse need to suspect anaphylactic reaction following the IM administration of streptomycin if the patient is complaining of edema and itching at the injection site, increase in indurations, increase in body temperature or vertigo. Answer is edema, itching at the injection site. Next question is while preparing a patient for surgery who has diabetes mellitus, the nurse should be aware of which of the following potential surgical risk associated with this disease. Option are altered metabolism and excretion of drugs, fluid and electrolyte imbalance, respiratory depression from anesthesia and poor wound healing. Answer is poor wound healing. Next question. Low erythropoietin level is seen in aplastic anemia, renal failure, obesity or hematoma. Answer is renal failure. Next question. Hemodialysis is a process of adding O2 to the blood, extracting waste from the blood, extracting antibody from the blood or mixing blood with essential nutrient. So answer is B, extracting waste from the blood. Next question. Process in which participant's identity, although known to the researcher, is not revealed to anyone outside of the researcher and his or her staff. This is called as anonymity, confidentiality, informed consent or direction. Answer is confidentiality. Next question. Dash is the ethical principle that indicate participants are voluntary and autonomous in nature to decide whether to participate in research or not. Options are beneficence, non-maleficence, self-determination and privacy? Answer is self-determination. Next question. A client is admitted to the hospital with a bowel obstruction. Which of the following is the priority nursing diagnosis? Fluid volume deficit, deficient knowledge, ineffective tissue perfusion, and pain related to abdominal distension. Answer is fluid volume deficit. Next question is, a client with late stage colon cancer had metastasis spread to the spine. Which of the following nursing action is appropriate to address a priority issue? Option are provided 5 small meal and snacks daily, give the client prune juice twice a day, allowed to have adequate rest, or give the pain drug at regular interval. Answer is give the pain drug at regular interval. Next question is, extrapyramidal symptoms occurs because nerve damage, drug toxicity, integration of somatic and spatial sensory inputs, or loss of automatic movement associated with skeletal muscles activity. Answer is D. Loss of automatic movement associated with skeletal muscles activity. Next question. Excessive or continuous stress on a tender result in condition called as tinnitus, tendinitis, bursitis, nerve entrapment. Answer is tendinitis. Next question is, economics provide a mechanism to obtain information about nutritional need of patients only, the number of patients admitted in emergency ward, the availability, potential and result of the healthcare system, or the entertainment preference of a healthcare worker. Answer is the availability, potential and result of the healthcare delivery system. Next question. The voluntary sector plays an important role in primary health care by replacing the public health system, by providing service only in urban area, by generating profit through healthcare services, or by serving particularly in the neediest area. Answer is by serving particularly in the neediest area. Next question is, which of the following is most appropriate nursing diagnosis for a client with strained ankle? Impaired skin integrity, deficient fluid volume, impaired physical mobility, or disturbed body image? Answer is impaired physical mobility. Which statement is appropriate when teaching a client about strained wrist? Option A. You may resume normal activity on discharge. Option B. Apply heat intermittently for the first 24 to 48 hours and then apply ice up to 72 hours. Option C. Don't use a compression classic bandage because it may cause compartment syndrome. Option D. Elevate the injured wrist higher than the level of the heart for the first 24 hours to reduce swelling. Answer is option D. Next question. The nurse is caring for a child who is taking corticosteroids for systemic lupus erythematosus. The nurse carefully monitors child's condition because the nurse is aware that corticosteroid can have what major action? They increase liver enzyme, they can make sign of infection, they can cause bone marrow suppression, they decrease renal function. Answer is they can mask sign of infection. Next question. Which of the following is a priority in planning care for a client with diagnosis of immune deficiency? Option A. Providing emotional support. Option A. Providing emotional support to decrease anxiety. Identifying factors that decrease the immune function. Encouraging discussion about lifestyle changes. And protecting the client from infection. Answer is protecting the client from infection. Last question. Impractical attitude to life is which type of grievances? Options are grievances are arising out of working condition, grievances arising from management policy, grievances arising from alleged violation, and last option, grievances arising out of personal maladjustment. Answer is option D. So हमने 20 क्वेश्चन किए.